Welcome to the Internal Medicine Masterclass Series 2026 Information Session. We're proud to launch this journey of clinical excellence with our very first masterclass. Pulmonology, respiratory medicine sits at the heart of internal medicine practice, where early recognition, structured diagnosis, and evidence-based management save lives every day. This masterclass is designed to equip you with systematic, practical approaches to diagnosing and managing the most common and complex pulmonary conditions you encounter in clinical practice, from chronic disease to acute emergencies, from infectious pathology to complex interstitial disease. This session brings together the full spectrum of respiratory medicine. Tonight's session will be led by specialist physician Dr. Ryan Supasad, guiding you through structured frameworks, clinical reasoning, and real-world application. This is more than a masterclass. It's the beginning of a new standard in internal medicine education. Let's begin.
Yay! Good evening, colleagues. It's a brand new week, brand new day. That means we have another opportunity to do awesome stuff, to pursue our dreams, to pursue our goals, or even to get closer and closer to some of the things that we struggle with. Whenever you wake up in the morning, you need to be grateful. Don't just finish the oxygen. Let us use it to improve ourselves, to improve our environment where we operate. And as health workers, one of those environments is to always be ready to care for our people, our patients, our families, and communities. It is such a great honor to tell you that our collaboration and partnership with our dearest physician, Dr. Ryan Swepesad, has just been elevated again. Higher and higher we go, because we are bringing a new series which is going to run for most of this year. We're going to go system by system. There is no corner of our body that we are not going to touch. That I can assure you. We will deal with common presentations for various systems. And this coming Saturday, we are hosting our first session, and we are going to look at issues of the lungs and helping these lungs to breathe better so that society can be healthier. So I'm so excited about this series. We've been discussing it, I think, last year with Brother Ryan. And whenever you talk about something and you plan it and you do all the work, as you get closer, closer to getting there, there's this excitement that thing, Brother Ryan, is coming, to life. We are bringing it live to you. We just want you to be better. We want you to enjoy life. We want you to be kept updated, confident, competent, so that you can care for your people. But this health system of ours is also struggling from many things. The one thing we have control over, me and you, is ourselves. The first prize is to lead yourself. So today we challenge you to lead yourself to clinical competency. So thank you for joining us. This is not like a traditional educational session. This is an information session. We are here for your questions. We are here to engage with you. So let me check in with my dearest brother. Woo, look at my technology there. It's not ready, Brother Ryan, but let me check on
Bo.
you. Are you well? Are you good?
All good,
2026
brother.
in the bushes.
In the bush. We are in the bush for this one.
In the bushes, yeah. Colleagues, let us give Brother Ryan an applause. A vuvuzela there, and welcome him officially to 2026. Brother Ryan, let me hand over to you to tell us about this awesome program and what colleagues can expect, and then we will take it from there. Awesome. Thank you so much.
Fantastic. Thank you so much, my dear brother. Good evening, everybody. God bless you. Thanks for joining us. Yes, we are excited. It's another masterclass series. So far this year, Brother Mawela, we've really kicked off in a flying fashion. We had the mock for the FCP2 candidates, then we had the mock for the FCP1 candidates, and now we are stepping back and just looking at common presentations.
Yeah.
So we're talking about pulmonology on Saturday. Yep, I hope you guys can see my slides and hear my voice. All right. So this is the series. For the next 10 months, once a month, we're going to be covering one masterclass looking at a discipline and common presentations in a discipline in internal medicine. So these sessions will generally last between 6 to 7 hours on a Saturday, and we're covering common presenting cases in medicine. And this is designed to help us to think through each presentation of disease systematically. It's important to be systematic or else we may miss things. So we're going to introduce a very systematic method of thinking through these presentations, introduced as case studies. So this is not theoretical primarily. It's based on a real life presentation of cases, and we're going to certify our approach in terms of thinking through these. So we'll introduce key aspects of the history, key examination findings, which lends itself to making the diagnosis, diagnostic tests and modalities, and how to interpret these in the right clinical context. Evidence-based treatment strategies are based on guidelines. And after each selected topic, we can have a little bit of a quiz to test your knowledge at that point. And then we're going to go to investigation. So when it comes to pulmonology, we'll be looking at three key investigations: the arterial blood gas, the chest X-ray, and the pulmonary function test. So we spend a fair amount of time just going through how to analyze these and interpret these. And at the end, I'm really excited about this one, brother. I've developed a master quiz where we're going to put forth the clinical scenario and we're going to get some engagement from you guys in terms of how to answer the questions. I've also included some OSCE type questions if you are going in for diploma exams or fellowship exams as well. So this is the roadmap. It's January. God willing, we can make our way through to October. And this is the first of 10 masterclasses, right? So it's pulmonology. And next month is medical emergencies. All right. Who is the series for? Well, anybody who provides care to internal medicine patients, whether it be outpatient, inpatient, whether you be a medical student, an intern, a community service officer, medical officer, a registrar, whether even you be a seasoned consultant in the wards, there's something here for you. Might be a physician assistant, even a casualty officer. This is for everybody who loves internal medicine, right? So this is just a basic outline of what to expect this Saturday. Like we said, we can be covering case studies, right? And essentially these aspects, I just want to give you an example shortly. And we already spoke about the investigations and the master quiz, okay? So 16 case studies. So conceptually, pulmonology is divided into pathologies affecting the airway, the lung parenchyma, the vasculature, and the pleura. Then we have some pathologies which affect any and all. And a classic example is lung cancer. So that deserves its own little pocket. So under the airway, asthma, COPD, bronchiectasis are the main heavy hitters. Under parenchyma, there's pneumonia, and there's different flavors of pneumonia, right? Community-acquired, nosocomial, ventilator associated. Then, of course, we have to talk about tuberculosis, pneumocystis jirovecii, right? And then pulmonary edema is cardiogenic, non-cardiogenic. Non-cardiogenic, otherwise called ARDS. Then interstitial lung disease, occupational lung disease, and we have to talk about sarcoidosis. Then under vessels, there's pulmonary embolus, pulmonary hypertension. Under pleura, there's pleural effusions, pneumothorax, and everybody's favorite mesothelioma. And then obstructive sleep apnea is also a problem which is gaining traction now because of metabolic syndrome. So this is a roadmap in terms of all the pathology we're hoping to cover. And I've got them all in the form of case studies. So we'll be looking at case studies of all of this. This is a classic example here, case number 5. Let's go through this. You got a 68-year-old retired policeman coming to the ED saying, "Doc, I'm coughing, I've got fever, I've got chills. He has been unwell for the last 3 to 4 days, but over the last 12 hours, his cough has become productive of thick yellowish sputum. He has developed chills, fever. He has lost his appetite. Yes, he does smoke 2 packs of cigarettes daily for the last 10 years. Clinically, you find that he's unwell, he's semi-sitting on the bed, he's tachycardic, he's pyrexial, he's tachypnic, his blood pressure is 140/88, but he's saturating fairly well at 93% on room air. Now, both lungs are resonant to percussion, with the exception of the right mid-anterior field, which you thought is dull. And auscultation reveals diminished vesicular breath sounds and inspiratory crackles over the right mid-anterior lung field, corresponding to that area of dullness to percussion. The remaining lung is normal, right? There's no clubbing, all right? And then we look at, okay, so this is a real patient, okay? And this is a real X-ray, okay? What do you see? So this is a classic example of consolidation, right? Right, mid, and lower lobe. So this is community-acquired pneumonia. Then we go into the actual meat of, so this is what his blood results showed. He had a neutrophilia, he had a leukocytosis, he had loss of band forms, okay, which speaks to sepsis, doesn't it? And then we look at community-acquired pneumonia, dissect it in terms of the definition, in terms of the signs that you expect. I've got some nice comics and cartoons to keep it fresh and exciting. Then we go into the actual guideline-directed management. What investigations will you do? A blood gas, the chest X-ray, ECG. We talk about why you're doing these. What are you looking for? What value does it add to your approach? Blood cultures, okay, sputa, which sputa to do? Okay, a scoring system. So the classic is the curve 65. Some people use the pneumonia severity index, but we use the curve 65. And that informs your management in terms of whether or not to admit. If you're managing outpatient, how are you going to treat the patient? If you're managing inpatient, how are you going to treat the patient? And then we look at the different organisms, the typical, the atypical. We look at also special mention of PJP, like we said, if you're considering COVID and respiratory viruses as well. And we separate community-acquired and nosocomial, right? And then special situations with PJP, with TB, penicillin allergy, what you're going to do for the patient. We touch on all of that. Then at the end of each subsection, selected topics have a small quiz. For instance, let's take your submissions on this one, everybody. Which one of the following is the most likely cause of pneumonia in a patient using IV drugs? So the patient's an IV drug user and has pneumonia. What's the most likely underlying organism? Is it Haemophilus influenza, Moraxella catarrhalis? Is it Pseudomonas aeruginosa, or is it Staph aureus? What do you guys think? A, B, C, or D? You can place it in the chat box, guys. Yeah, right. Okay, I think maybe everybody's hungry and didn't have supper yet. Okay, thank you, Bongani. D. D, Staph aureus. Another example, this is another question, just to give you guys a small idea of how things will be set up, right? So exposure to birds, you got to think about certifications. So that's that. Now, Brother Mawela, I'm really excited about the master quiz. The master quiz I've put together as a consolidation to test all the knowledge we have acquired over the previous discussions. And this will take about 90 minutes or so. So I introduce you to a clinical scenario like this. Let's quickly go through this. A youngster with asthma comes in short of breath. His symptoms occur daily, more frequently at night, also severely causing functional limitation. He is taking salbutamol, inhaled steroid, salmeterol, which is a long-acting beta-2 agonist, montelukast, which is leukotriene modifier, and his oral steroids. On exam, they are mild wheezes bilaterally. Labs show an elevated IgE and eosinophil count. So usually the master quiz entails 4 questions. What is the most likely diagnosis? What's the best next step? What is the most common side effect of step number 2? Or what is the best counseling, right? So this is an example of the answer. This is severe persistent asthma. So when we get into asthma, there's a way to classify asthma. And this is severe persistent. He's on max doses of all the therapies, right? The next best step, in light of the fact that he has a high IgE and eosinophil count, is something called omalizumab. So omalizumab is an anti-IgE therapy used in refractory asthma with elevated IgE. What's the most common side effect of omalizumab? Anaphylaxis. In light of that, what's the best counseling? You're going to make adrenaline pen available to him to counteract anaphylaxis if he does have that in response to omalizumab. This is just an example, guys. We'll go through many, many cases with the same format just to kind of solidify and establish the information that we discussed. A couple of OSCE questions as well I've got in the mix. An example of right-sided lung abscess and chest X-ray. This is a classic example of sinus tachycardia in a surgical patient with S1Q3T3 right ventricular strain. You know, this is a pulmonary embolus, right? And we get into PE as well. All right. So, conclusion, guys, this course is designed to give you a good foundational grasp for common presentations to internal medicine, which are respiratory cases. I presented them in the form of case studies to underpin the practicality of this material. And we're going to be discussing management as per guidelines. We're going to be looking at an approach to investigations. And we've got the master quiz and the OSCE quiz to further reestablish the concepts and to integrate more complex aspects for those of you guys going for exams as well. And I will see you there this Saturday. Let's go fit.
Noma
Thank you so much.
kanjani. We will be there.
Kanjani.
We will be there, Brother
Awesome.
Ryan. Just expect us. Just expect us to be there. I promise you, we will be there. Maybe let me quickly just show colleagues how to navigate our website. So yeah, I think you can see to a certain extent. No, I haven't shared from Zoom, right? Because I'm also, I want those who are online to also see it. Yeah, so I hope now everyone can see it. So this is our website. If you just type in www.clinicalcareplatform.com, which is our website, or you click on the link that I've just shared there on the chat, you can then scroll down. If you scroll down, boom, Pulmonology Masterclass, right? As you look at it there, and there's Learn More, the button there at the bottom. You just click on it. As soon as you do that, it will take you to the information page, which tells you about the masterclass and the times and what you can expect from the masterclass, 7 CPD points, and what we are going to cover. We also talk about how valuable this is. I didn't see that the team has put their research there to say CCP is not cheap, but we are trying to be affordable, and we are going to also address various topics. You can book your seat by clicking that button there on top, book your seat, or also on your right hand side there you can click on register today. If you are joining on your phone, there will be a button at the bottom of your screen that just says register today. I'm gonna click on it, and boom, you are on the payment page. It doesn't have a lot of things. You just put your name, your email. If you are from one of our countries here in Africa or even other regions, you can actually change the currency. If you are a member of the platform and you want to apply your 10% discount, you click on apply coupon code, which you are looking at there. As soon as you click on it, this part here will show up. Capital letters only, no spaces, no nothing, just the number, the member, not even 20, it's member 26, if I'm not mistaken, because I haven't done this in a while. Yeah, you can see that the 10% discount has been applied and you have saved almost 100 rands. Then you go for it. Also note that our payment system is safe. It is facilitated by PayFast. As a platform, we cannot see anything that you do there. The only thing we will get is a confirmation that you have transacted, and if there are any issues, do let us know. But so far so good. We've been running this for the last 3 and we are heading for our 4th year, and we haven't had any issues. So you can trust that we have your interest at heart, and we always want to do our best. So let me go back and switch my screens there. Brother Ryan, this partnership
Yeah, bro.
continues to grow, brother. I see you love and love teaching. Why do you love teaching? Why are you doing this?
Oh, brother. If you look at Abraham in the Bible, right, he was
Yeah,
blessed to be a blessing, right?
blessing. Yeah.
So whatever we do, whoever we are, if we
Mm.
just are keen on blessing others and
Yes.
empowering others,
Yes.
I mean that's our calling, right? So
Yes,
yeah.
yes. In my leadership world, we say you grow yourself to grow other people. And you have, if you want maximum impact, we want 1,000 Ryans out there, people who are very good in internal medicine. I've also noted that when you look at the death statistics in South Africa, respiratory conditions continue to be a significant, probably the leading cause of death, because TB most of the time is a respiratory condition. So they are common. People die a lot. What's your analysis of what's going there, and what do you hope this program can do to at least help us to lower those
Mm,
rates? Yeah.
mm. Brother, in the great words of Shakespeare, he
Yeah.
said, TB or not TB.
Yeah. To be or TB.
No, yes. But
Yeah.
so yes, we know about TB, but sometimes all TB is not TB.
TB. Yeah.
So this is going to help us decipher our approach.
Yeah.
If we're not winning with TB, maybe it's a pulmonary embolus, maybe it's another cause of pleural effusion, maybe it's interstitial lung disease.
Yeah.
So this helps us to really stratify our approach. But given the mortality from respiratory disease is significant, and we're going to try through our teaching to bring that down a bit,
Down.
God willing.
Yes. 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 And I think the other thing is the timeliness of presentation. But also, we know there's also the timeliness of making the diagnosis, which also contributes sometimes to delays. So we are looking forward to this program. And from what I see, if I'm a specialist, I can join. If I'm a medical practitioner, I can join. Nurse, pharmacist, I don't know. But are there any obvious exclusions?
Uh, if somebody can't read,
You must be a health worker. Just join, colleagues. This is not
yes,
about super specialists. This is common presentations. And in the health system, everyone has a role to play. Clinical associate, don't even bother. Just register, attend, and be empowered. Dr. Tambwe says they want the program for the year. Okay, yeah, maybe we can publish that. So we'll just finalize it and put dates on
uh,
everything. But I can tell you, it will be the last Saturday of each
got this one
month.
here, brother.
Yes.
How's this one?
Yes.
Yeah.
Oh. Did you share? Yeah. Okay. Awesome. So you are. I hope you can see it there. Let me also help my what you call my Facebook people to see it as well. That there is the schedule. You'll see it's relatively towards the end of the month, unless if we miss some holiday. At that point, we will let you know. But so far, that is how we're gonna handle it. Yeah, so I think from my side, I've dealt with most of the questions. We have to transition to the diplomas are still live. Hey, I don't know what happened with this cohort, brother, right? We've been teaching for almost 5 months,
Yes.
if you check carefully. But it's because of maybe the festive season. So we have child health starting
Yes.
in the next 5 minutes. Colleagues say, by now, if you're a member, you are eligible for your 10% discount. All attendees will get their CPDs. If you know that you don't work on Saturdays for religious reasons, I always get those inquiries, or you'll be on call, but you are interested in the information. The rule is always to register. Then, after the program is done, we generally convert these into self-paced versions so that you can go through it, and when you complete, you are still able to get your credentials and CPDs as well. But I'm hoping that you are excited as I am. Are you guys excited? Give us a sign, some thumbs up that the program is starting. It's powerful, it's different. ECG will come, mechanical ventilation will come, lab interpretation will come, chest x-ray will come, but we want to spice it up a bit. Can you guys give us a sign, some thumbs up to say, yay, something fresh, something for Evan? What's happening? Oh, is it from me? Rockets, look at that. Oh, I didn't know that there's a host when I press. Let's see, balloons. I didn't know.
Wow.
Woo! All right, colleagues, just to say thank you so much for joining us. Brother Ryan, as always, thank you so much. And we are seeing you on Thursday. We have an awesome session on chest X-rays, right, brother? Right, chest X-rays
Yep.
on Thursday.
Yep. Quick
Don't
fire,
miss
quick
it.
fire X-rays.
Yes, don't
That's
miss.
maybe a step up to Saturday, brother. Like a
Yes,
little bit of
yes,
appetizer.
yes,
Yes.
yes. It's the launch pad to Saturday. On that note, may I wish you a restful night with your families. Unless if you are a diplomat, there's no rest. We also have obstetrics at 8, and I think we have FCP part 1. FCOG. Woo! Sharp, sharp, guys. Blessings. Bye.
Bye.
Welcome to the Internal Medicine Masterclass Series 2026 information session. We're proud to launch this journey of clinical excellence with our very first masterclass. Pulmonology, respiratory medicine sits at the heart of internal medicine practice, where early recognition, structured diagnosis, and evidence-based management save lives every day. This masterclass is designed to equip you with systematic, practical approaches to diagnosing and managing the most common and complex pulmonary conditions you encounter in clinical practice, from chronic disease to acute emergencies, from infectious pathology to complex interstitial disease. This session brings together the full spectrum of respiratory medicine. Tonight's session will be led by specialist physician Dr. Ryan Supersat, guiding you through structured frameworks, clinical reasoning, and real-world application. This is more than a masterclass. It's the beginning of a new standard in internal medicine education. Let's begin.